Get started and then we'll crack on. Okay, good morning. Welcome to the Overview and Scrutiny Commission. It's Thursday the 29th of February. We'll start with agenda item number 1, which is apologies and substitutes, please, Ruth.
Thank you, Chairman. We've received apologies from Councillor Eagle, Councillor Land and Councillor Richmond, and we have Councillor Sarah Taylor as sub for Councillor Land and Councillor Jacob Morgan for Councillor Richmond. Thank you.
Lovely. Thank you very much, Sarah and Jacob, for substituting. It's appreciated. Move on to item 2, Chairman's announcements. I do not have any. Item 3, urgent business. I'm not aware of any. Item 4, does anyone have any declarations of disclosable pecuniary interests, please? None. Thank you very much. Non-members wishing to address the meeting, you are welcome as ever. Please do contribute to the debate if you want to. And then we'll move straight on to the main item today, which is item 6, the call-in, which is related to the future of inspiring communities. And as you can see from the agenda, this is something that I've asked to come to scrutiny. It went to Cabinet, and I think it's right and proper that it comes to us here at Scrutiny as well. It's a very important subject. I just want to give a bit of an introduction and say I think everybody in this room would support inspiring communities. It's incredibly positive, and we're really fortunate as a council, I think, that we're able to undertake such a programme. But it's also really important that we get it right. And I think for us here as Scrutiny, in our role as a critical friend, I think we've got an important job to play to make sure we get it right, partly from a value for money point of view, but also to try and ensure as best possible that the opportunities are realised, the opportunity to help people as much as we possibly can within the funding available, and to make the programme as successful as it can be. So my hope today is that we can have the presentation from the team, and I'm very grateful for Tristan and his team for coming along today. But I hope we can have a debate about what matters to us as members and how inspiring communities could be as successful as it possibly could be. That's my hope from today. So without any further ado, I'm going to hand over to Tristan, please. Thank you.
Good morning. Thank you very much, Chair. Good morning, everybody. Thank you very much for the opportunity to come before you today to discuss the exciting Inspiring Communities programme, which was approved at Cabinet earlier this month. This innovative programme represents a significant step forward to accelerate positive health outcomes and to support some of the most vulnerable residents in the communities. We all recognise the challenges: an ageing population, social isolation, mental health issues, and disparities threatening to leave many behind. But as shown within the presentation that you will receive today, our officers, who I'm extremely proud of, are working hard with our partners to offer solutions and tackle health inequalities within the district. Today, we open the floor for questions and a deeper exploration of the programme's details. Your contributions are invaluable in ensuring its successful implementation. We want to hear your feedback, answer your questions, and engage in a collaborative dialogue to support the delivery of the programme and maximise its impact. This is not just another programme, it's a call to action. It's a call to support our most vulnerable residents and amplify the voices of our communities. This programme is a testament to our collective commitment as councillors to build a stronger, more vibrant and healthier district. Let's use this opportunity to work together, ask the important questions, and ensure Inspiring Communities becomes a message of hope to our residents who are struggling, and a vote of confidence to our partners that Breckland Council wants to support their residents. We welcome the opportunity to present the work this council has undertaken and plans to undertake in the next 3 years. Thank you.
Chairman, if it's okay, we'd like to just go through a presentation just to put into context what we're talking about. just to really ensure that all members are familiar with the journey we've been on with Inspiring Communities. Josh, can I have the next slide, please? So the journey actually started back in 2018, and that's where we as a council began to work with children's services and understand the synergies that we have with them and looking beyond our own organisational boundaries. We set up a multi-agency hub at our offices in Thetford, but most importantly is we began to, we set up weekly multi-agency collaboration meetings. They started off with just 2 agencies in a room talking. We now have 60 plus agencies signed up who still come together every week to talk about complicated cases. That led us to start to understand and think about our residents perhaps in a different way and understand vulnerability within our communities. And in 2020, this is where the Inspiring Communities started, with our members supporting the contribution of £1 million into what we called then the Vulnerability Programme. And we looked at the evidence and we prioritised 4 areas of that programme around mental health, social isolation and loneliness, domestic abuse and county lines. And we began to structure ourselves and put interventions in place to help support around those priority areas. A couple of months after we made that decision, the pandemic hit and we were in lockdown, and we never knew that was going to happen, of course. But because of our thinking and because of the work we'd done to get the programme approved, we as a council were prepared to quickly mobilise and step up and support our communities, which is what we did. And members, I'm sure, will remember the work done by the officers, done by our partners, and undertaken by our community groups to support those who were most vulnerable. That led us in 2021 to secure Inspiring Communities as a corporate plan theme. It was something that was so important to us. We wanted to elevate it from a programme to a theme in our corporate plan, and it became a way that we thought about our work. In 2022, following that, was the implementation of the integrated care system. So we began to see our role as a district in a wider health system. But of course, because we'd started our work back in 2020, we were already acknowledged as a partner in that system. And we were trusted. And that helped us because it meant that partners looked at us as an extension of their service delivery, and we understood how districts can impact on the wider determinants of health for people. And Sarah and Josh will go into that in more detail. So we sit here today as a trusted partner in that system, a trusted partner of health, but a trusted partner of the voluntary sector and a trusted partner with our communities.
Good morning, everyone. So our approach throughout the Inspiring Communities programme was and continues to be the creation of strategic partnerships, enabling us to work collectively to improve population health and social care. And we've done this by co-designing evidence-based innovative interventions. In doing so, we've diverted demand away from frontline health and social care and other statutory services. Excuse me. Next slide, please, Josh. So these are the services and projects that we have offered through the programme to date. So we're commissioned by Mid-Norfolk PCN to deliver social prescribing services, picking up the non-clinical issues being experienced by our residents, such as debt and finance issues, social isolation and loneliness. Also low to medium mental health issues, benefits, welfare rights and domestic abuse support. And these are all onward referred. We are continuing to evolve our social prescribing services to increase capacity and offering specialist mental health services across more of the district. We have welfare officers that hopefully some of you are familiar with. They receive referrals directly from residents, but also from you, elected members, and they offer a holistic assessment of need. The dominant concerns that they're being presented with are health or financial, and we've been able to use funding to support these residents. Moving forwards, we're looking to fully integrate our welfare services into our housing service to ensure that we've got a comprehensive assessment of needs for all our customers, our housing customers that are presenting to us. Our innovative community health worker project, which we deliver in partnership with the Integrated Care Board and Mid Norfolk PCN, sees 2 people that have been recruited from the local community visiting people identified by local GPs who are at risk of poor health due to lack of contact with healthcare services. This project has been extremely successful to date and continues to be, and has certainly saved at least 3 lives. The Breckland mobile food store was the first of its kind, visiting rural locations across the district, offering access to low-cost food. But more importantly, we've used it as a way to identify wider vulnerabilities. As the service has evolved, we've embraced the community networks out there, wrapping community provision around the mobile food service. Our Mindful Towns and Villages see residents come together to be collectively trained in mental health first aid, suicide prevention, and more recently, youth mental health. We now have over 300 mental health community champions in our district supporting our communities. We continue to evolve this programme as well, and so that we can cover more of our communities into the future. Our community enablers work with community groups and other local organisations to give them the skills and resources they need to develop local projects independently. And to support this development in our community, Breckland has issued over £300,000 worth of grant funding in the past 3 years. To support the work that the community enablers do out in the community, we have built a web portal which provides connection, shares best practice and tracks activity. And in addition, we host quarterly in-person network sessions in partnership with our VCSE leads. Steve's already mentioned our early help collaboration meetings. They've gone from strength to strength over the period, and we now have over 180 professionals signed up across 60 organisations. It brings partners together each week to talk about different cases to help secure solutions for our residents before they reach crisis point. And our commissioned debt advice service from Citizens Advised, it's providing integrated support in our offices here at Dereham as well as in Thetford, and that's working very well as well. So far, the amount of debt reduced or renegotiated for our resident using the service is over £900,000. Next slide. To you, Steve.
Okay. So just very briefly, we've talked about and we'll continue to talk about partnerships in this presentation. That gives you a bit of a snapshot of the agencies that we work with, and it shows that we genuinely look beyond our own organisational boundaries. We recognised when we started the Inspiring Communities programme that some of the benefits wouldn't necessarily be seen by us as a district council, but we understood that the ultimate beneficiary would be our residents, and therefore that's why this slide sums up everything that we try and achieve and how we do it. And then why do we do it? What we want to show you here is for our residents, life's really complicated, and that's what we've learned over the last 4 years. People's issues aren't one-dimensional. They present with a housing need, or they present with a need for low-cost food, or they talk to us because they've got concerns about their mental health or their children's mental health, or that they are affected by domestic abuse. But it's often not just that. There are lots of things going on in people's lives, and when residents look at the system, it's really complicated and people don't know how to access it. And sometimes people just struggle on as best as they can. And often that will lead them to transition into crisis point. What we've tried to do is to help people when they present to us, when they touch our system, we've tried to kind of wrap ourselves around them and help navigate them to the right place. That's how this slide shows that complicated system, but that we're here to help residents get the help that they need. So when we look at the outcomes, what have we actually achieved? Well, through our partnership with DAISY programme, we've supported over 1,000 survivors of domestic abuse. And when we go and speak to the DAISY programme and speak to those survivors, the change in their lives has been dramatic. But I think most importantly is because of our intervention, because of our partnership work with Daisy, they've recruited and trained over 100 volunteers to act as Daisy ambassadors. So they are predominantly women who've been affected by domestic abuse themselves, who've been supported through our partnership with Daisy and have come out of it, but want to support others who are like them. And that's phenomenal. We've helped almost 2,000 residents to access low-cost food, whether that be through the fixed hubs across the district. The first one we put in place was working with Norfolk Community Foundation and the Charles Burrell Centre. And then we thought that there was a need right across our district, which is why we piloted the first of its kind, the rural mobile food bus. So that's helping people with low-cost food. But most importantly, because of that infrastructure we've got supporting it, it helps for those people when they've identified as needing low-cost food to be referred into the system. And we see that. We see referrals going from people accessing the food bus into the collaboration meetings that are held weekly. Over 400 residents have accessed the Silver Social. So this was started with Arts Council England funding, identifying Breckland as a cold spot for social isolation. Age UK evidenced that. And this was a programme of activities for older people in locations that the evidence told us there's more likely to be social isolation. So our residents have accessed those services. Independent research of them tells us that it's impacting and improving levels of anxiety, it's improving levels of social isolation, and it's improving levels of happiness. But it also, through the scheme, there's also digital training as well, so people are feeling less digitally excluded. We've helped 250 residents via Breckland collaboration, as I've mentioned numerous times, so they're the referrals going into that multi-agency support hub. We've trained 300 mental health champions across our district, so that means we have started a movement of people who are confident and competent to have a discussion about mental health in their communities. That's now spread. It's now being delivered in Broadland and South Norfolk, and there's interest in Norwich and North Norfolk to make Norfolk a mindful district. A mindful county. As Sarah mentioned, we've supported over 200 residents with welfare support calls. We've helped over 90 young people and their families to manage their mental health. We commissioned cup of tea services to deliver interventions across Breckland for families and young people who are on a mental health waiting list to stop them transitioning into crisis point. We've enabled the opening of a rest hub in Thetford with Norfolk and Waveney Mind, and they've now supported over 1,750 residents. And again, it's looking at the join-up in services. So people who are coming to our service centre in Thetford because they've got a housing need, if you go and watch what happens, they will often then end up speaking with colleagues in Mind for that mental health support because there's underlying levels of anxiety. Equally, if people are going to Mind directly, you will see Mind employees escorting them across to talk about housing or now, thanks to the Commission service, to talk about debt. It's all interlinked. We've worked with Citizens Advice to deliver over £700,000, I think it's £900,000 of income gain or debt write-off to our residents. Our own debt advisors themselves, that £88,000 investment, they've written off over £350,000 of debt straight through the services delivered here and out of Thetford. But the wider partnership with Citizens Advice is over £900,000. And we've engaged with 260 households through the community health and wellbeing workers. So these are the two officers who go out every day in Watton and knock on people's doors. And they don't know what's behind that door. This is an innovative approach that is new to us here. And they speak with people and they build up relationships and they help identify what's going on in their lives and they direct them to GP services if they're needed. The GP service has reported the highest number of vaccinations. They've reported more planned appointments, therefore less crisis level appointments. But I think most importantly is the intervention of our officers has led to 3 preservation of lives. So people who explained that they were at the point of taking their own lives, but thanks to either an emergency intervention or ongoing support, that hasn't happened. And we always try and look wider about how what the benefit, what the impact is that we're having. Now, with prevention, of course, it's very difficult to identify what hasn't happened. But we understand that there's academic research out there that helps us at least to quantify from a financial perspective the benefits that we're seeing. So this was generated by the NHS. So the NHS were evaluating after 9 months our community health and wellbeing worker project. And this is the NHS's own estimation that for the households that we're engaged with, it saved the system through those areas, £616,000. That doesn't include the cost of the suicide prevention, which would add another £1.6 million worth of savings into the system. But that's a demonstration of how we look to see the wider impact on the system, recognising, as I've said at the beginning, that when we started the programme, we acknowledged that Breckland Council itself, wouldn't necessarily benefit from it all. It's a system-wide partnership approach. What we want to do here is, you've heard a lot of us talking about it, but it's wider than us, and we thought we'd let you hear the words of some of our partners, particularly focusing on health here, about how they feel about our partnership and about how they feel about our Inspiring Communities work.
My team and I are partnered with Breckland Council and the ICB to design and implement the exciting new community health worker service. This innovative project is making a real difference, with the patients telling us they feel better informed about services available to them. Having someone spend time listening to their needs ensure patients are getting the right care from the right services at the right time. In the short term we've established this service, they've connected patients to mental health services, community groups, citizen advice, housing services, and remain a constant source of support to the community. They have even helped prevent a young patient from ending his life.
South Norfolk Healthcare is pleased to work with Breckland Council as an outstanding partner with a strong record of delivering early intervention services to those who need it most. So it was my pleasure to put them forward to Mid Norfolk PCN as the provider of choice for their social prescribing service. The partnership continues to evolve, and I can see firsthand the impact this is having on our patients, from improved health to reduced strain on frontline NHS services. Due to this success, we have been delighted to increase the investment from 2 social prescribers to 4, doubling capacity to divert demand away from health staff.
Myself and my colleagues are one of the largest referrers to the Breckland Council social prescribing team. We are hugely passionate about the benefits of social prescribing to our patients, and the partnership with Breckland Council ensures people get the wraparound care they need when dealing with issues such as housing, debt, loneliness, or other complex social needs. I've seen firsthand the positive impact social prescribing has for my patients as a result of the interventions provided by the Breckland team, who I believe have dealt with over 1,000 referrals for the Mid Norfolk PCN so far, and do so with the utmost professionalism and compassion.
Apologies. So we've shown you the journey that we've been on as a council. Have we got some feedback?
No.
Is that okay? Sorry. We've shown you outcomes of the work that's been delivered, whether on our own or in partnership. And you've just heard directly from some of the partners that we've worked with over the period about the difference that we're making in the system. This programme has been recognised wider over the past 4 years. In 2022, we were shortlisted at the LGC Awards for Public Partnership Award. And then, more recently, in 2023, we were the winner of the Health and Social Care Award at the LGC Awards, being the only district council to be shortlisted for the final in that category. The independent external peer review focused on inspiring communities and concluded that the programme was exemplar. And finally, more recently, we were recognised by Norfolk and Waveney Mind and were awarded an Outstanding Contribution Award late last year.
So that's the kind of backward look at inspiring communities. Tells you where it started, where we got to and how it's evolved. So the programme has evolved over time and it's natural that programmes do that. We were in space that district councils don't ordinarily occupy. And as such, we were learning as we were going along and we saw us needing to respond to things that we hadn't predicted were going to happen, namely the pandemic and the cost of living challenges that followed that. But ultimately where we came to is the same place as Duncan Selby, around who was the founding chief executive of Public Health England, that a job, a safe and warm home and someone or something to care about are the foundations of what works for improving health. And we've used that as our guiding light based on 4 years of learning to design the programme moving forwards. And we'll take you through what that looks like now.
Good morning, everyone. So first and foremost, our programme includes looking at the delivery of a Derham Early Help Hub with an internationally recognised charity, that being Mind. The idea behind it is to establish a multi-agency support hub to enhance wellness, employment and skills, development and community support. The hub will function as a professional and accessible centre, bringing together local organisations, healthcare providers and specialist organisations to provide wraparound support and wider community-based services to our residents. The second point is around the evolution of the food support model. So we heard within the first part of this presentation about the success of the mobile food store. So as part of this, we are looking to develop a model which is based upon the supermarket-style delivery van using our UK Shared Prosperity Fund. The provision will see the introduction of pop-up hubs and community hubs, ensuring residents have access to that wider wraparound support, talking about things such as or our partners such as the CAB, DWP, working alongside healthcare providers to potentially provide vaccination support when we go into the winter months, for instance. The next part is around the investment of ASB resource. So to effectively address ASB in local communities, we are investing in a dedicated area-focused ASB resource. This dedicated officer will focus on proactive measures to prevent and address ASB incidents through the implementation of an ASB action plan. We're also looking at extending the contracts of our community enablers and the welfare support officers. So by doing so, they play an integral role within the council and the impact that they have on residents, as Sarah and Steve alluded to earlier. These roles serve as critical connectors and advocates, working to provide individuals, families and community organisations with essential resources, offering crucial support and cultivating positive and lasting and, most importantly, sustainable relationships. We're also looking to bring housing and communities together to foster a more holistic approach to supporting our most vulnerable residents. We will explore opportunities to look at how we can work together with the welfare officer we have in the communities to provide the extra support to vulnerable residents who are in need. And also by working together, we will create a more supportive and equitable environment, enabling residents to be identified before they reach that crisis point. And also we'll continue to work with our partners. As alluded to on a previous slide, the sheer amount of partners who we are currently working with enables us to deliver that whole system approach to supporting our residents. So just focusing on some of the financial aspects of the new the new Inspiring Communities programme. So there is no increase to our revenue budget based on these proposals, and we will continue to direct our resource to the reduction of the temporary accommodation costs. So firstly, I'd just like to touch upon the Dereham Early Help Support Hub. So the UK SPF Fund will fund the development of the Dereham Early Help Hub for several reasons. The UK SPF aims to level up the economy and society. The Early Help Hub will address multiple needs like wellness, employment and community support. But there are other aspects that it touches upon. So ultimately improving lives for residents by providing access to resources and support. The hub can help improve the health, employment prospects and overall well-being of residents. Building upon community resilience. By fostering community connections and offering support services, the hub can help strengthen the social fabric and empower residents to tackle local challenges. Also boosting local economies. So by supporting residents in acquiring new skills or finding employment, the hub can contribute to a stronger local economy and create a more skilled workforce in the district. And then just touching on the evolution of the food support. So the revised mobile food service will target areas experiencing health disparities, directly addressing the UK SPF's mission to tackle inequalities. The funding allocation aligns with the broader objectives of reducing the cost of living and ultimately combating food insecurities. And the 1.12 million total commitment for the next 3 years, in addition to the external funding, we will continue to pursue and lever into the service for the benefit of our residents. So outlined on this slide is the plan, how we expect to deliver that wraparound support for our local communities, help support our most vulnerable residents. So through the extension of the debt advisor services, we are currently through a cost of living crisis. We need that support to help. And as alluded to in previous slides, we are really making a difference to our local residents. We need that support going forward. And that's why we are looking to extend the debt advisors for a period of 1 year. We're also, as touched upon, the Early Help Support Hub, and that's a service charge. But ultimately, what will happen with that is that we'll be able to provide that support to our residents. That will enable access to a one-stop shop in some aspects to support local residents who are needing that support through community services, employment help. There's that real opportunity to do so, and we see that as a vital investment for our communities going forward. The DAISY programme. So we've seen, you know, the statistics speak for themselves in some respects. 1,000 survivors of domestic abuse have already been helped. We need to continue that service to enable more who are experiencing such awful situations to be supported through going forward. The Mindful Towns and Villages, it's been alluded to already, but we see this expanding. This is a real opportunity to support residents on a localised level, to increase access to mental health champions, to support themselves, to function and hopefully provide that wraparound support in their local community, going back to a stage of asset-based community development to really support the residents. The community enabler and welfare officer roles as well. So we've touched upon it already ultimately, but the vital services that they're playing, not only connecting a welfare support to our residents who are most vulnerable, but being proactive with the community enablers, engaging with local communities, engaging with local community organisations. This is where we want to take the Inspiring Communities programme forward. We want to be proactive in our measures, and we see them as a vital role in connecting with community organisations and residents going forward. We've talked about the ASB and fly tipping offer as well, and the work that which needs to be supported to ensure that we are effectively tackling ASB within our local communities, supporting of citizen advice, working alongside our partners to continue and enable them to deliver such services which have supported so many people and residents within our local communities. And finally, around the Inspiring Communities match funding. So as part of this, it's giving back to our local community organisations. It's supporting residents and community organisations on the ground to deliver support to tackle health inequalities within our district. We understand that we cannot do this alone. So alongside working with our partners, we are working with these local voluntary sector organisations, charities, to support the delivery and tackle health inequalities within our district.
Okay, that's it. Lovely, thank you very much. Really useful presentation, lots of information in there. So I'm going to open it up for debate and comments and suggestions, please, from Commission members. Got Sarah at the back there, please, Sarah. I know you've got a sore throat, Sarah, so hopefully you'll manage.
Well, let's see how loud this is. I'm so sorry for the awfulness of my voice. It's not just a quick question, Stephen. There was a great presentation, but I was struggling to read a table. Just quickly, is it possible, please, for you to circulate the tables that were in the presentation? I could see the last one was the content actually in the report in the agenda, but the one produced by the NHS, it would be, if that's possible to circulate now, that would be really useful to inform this discussion. Thank you.
Thank you, Sarah. Jacob, please.
Yeah, I'll just comment. I mean, the plans have been approved at Cabinet where comments were made. I understand the programme as a whole was reviewed at Scrutiny last year and will be again this year. So there's been that opportunity for feedback. And I think this is such an award-winning programme that's really made an incredible difference, especially to the most vulnerable in our district. We can see it saved the health system 1.8 million, which is incredible. And I'm sure that the plans going forward, they've been shaped by the learning work and the evidence, not just by the council, but by all the partners that we've worked with this. And I'd just like to say, as a councillor, I'm really proud of the plans that have been shaped by the team and have then been approved by our council's cabinet.
Okay, thank you, Jacob. I've got David, please.
Thank you, Chair. Well, first of all, I think that I'd like to congratulate the team as a whole because this is a very good presentation, and in my mind, it's a very important part of our role as Breckland Council to look after our residents. I just want to sort of highlight the food issue, if I may, just for a moment, because obviously the food bus doesn't go everywhere in the district. We are very fortunate in Swaffham in having a very active and well-structured community fridge. And I don't know whether that concept has come into your discussions in any shape, way or form. The community fridge, of course, is absolutely free. There's no cost involved. And the queue outside our community centre for the community fridge for 2 hours in the morning is always an extremely long queue. And it's run by volunteers, of course. But the concept of the community fridge, which doesn't appear in excuse me, I'm sorry, doesn't appear in your presentation. I'd just like to know whether that's actually come up for debate or discussion, because I think, particularly today with food prices escalating at such a rapid rate, free food, which otherwise would go, by the way, to waste. And 95% of the food that is collected by Swaffham volunteers from Tesco's, from Waitrose, from Iceland, etc., it's actually saved from going into landfill. So there's another benefit to the general public in that sense. So a comment on that, if I may. And I think speaking as a ward member for Swaffham, and it's just my personal opinion, that in fact I think a visitation to the 5 market towns in particular with the ward members would be very much appreciated, because of the structure, the overall structure of everything that you do, which is brilliant. I think the ward members would benefit from knowing a little bit more firsthand on a direct basis. Thank you.
Thank you. Steve, would you like to respond to that or pass it over?
Just initially, Chairman, thank you. Thank you for the comments around the community fridge. It's good to hear. We introduced the community fridges across the district, so it was this council that enabled community fridges to be accessible to the community in Dereham, in Swaffham, and I think there's two in Thetford and an additional one either in place or coming online in Watton as well. So we are, again, we were at the forefront of that, which delivers the benefits of free food to our residents, but also importantly diverts that food from going to waste and into the waste system.
Thank you. I've got Harry next, please.
Thank you very much, Chairman, and thanks to the team for your comprehensive presentation. I did attend the Cabinet and made a number of suggestions. I mean, firstly, I think as a Dereham Ward member, I'll be very keen to learn more and collaborate with officers and colleagues, you know, outside the meeting in terms of Dereham Early Help Hub, and we've got suggestions particularly involving potentially meeting points and other colleagues involved in dementia outside that, which can be also involving prevention. I've had informal discussions with Steve James about that. I see today's session as being a sort of introductory session in opening up members to what we do, what we've done in the past, but how we're doing. And I personally would very much hope that we can have perhaps some sort of regular, doesn't have to be obviously monthly basis, etc., but we can have a regular update on this. So this is, having had the introduction, we can then get into some more of the detail. One of the questions I had or suggestions would be obviously is when we started off the programme, we had priorities around domestic abuse, social isolation, mental health and county lines, so we arrived at those. With my sort of public health background, I'd be interested in some more of the granular and sort of the micro detail in terms of these are the areas that we're focusing on, how we arrived at those. Are there any areas that we might want to focus on if we had more resources outside the 1.1 million? Are there any areas that we might want to capture around things like there's delayed discharges to social care, which is a big factor in the county and just generally, and that's going to impinge on things like disabled facilities grant. There's the rise in obviously diabetes and obesity and things in relationship to sport, so some of those relationships there, but also how we then drill down a bit more into the, if you like, the public health profiles and say these areas that we've reached, that's why we've chosen those areas, you know, with the support of health statisticians, people, NHS, etc. Those areas that we can't get into at the moment, but we might want to get into. And I think for anybody that wants to have a sort of top level, start at the top level, on the 6th of March, the Norfolk Health and Wellbeing Board is meeting. They've got, as you see, they've got 44 partners round the table. I think the team referred to the number of partners. There's at least 44 contributors there in a 3-hour meeting, followed by about another 3-hour meeting. Some of that's online and the public can ask questions. That illustrates both the depth but also the complexity of where we actually fit in. I know Tristan is one of our representatives there, along with I think everybody that you could possibly think of with charities, and I think that would be a useful thing people to understand where we fit in. And as you say, some of the benefits aren't always apparent, and obviously I'd be keen to support the team with suggestions around the evidence base, etc. But I'll stop there. Thank you, Chairman.
Hey, Tristan, do you want to respond to that specific point about the Health and Wellbeing Board?
Yeah, I'm grateful, Chair. And thanks very much, Councillor Clark, for your contribution. The team and myself are certainly more than happy to listen to councillors and any interested parties throughout the course of this programme, because we are a learning council all the time. I think you make a good point with regards to the other issues that are on the horizon, and that's the benefit of the integrated care system that was implemented in 2022, and as you highlight, the Health and Wellbeing Board. Steve, I think Steve, I certainly will be there next week. It's a fantastic forum to be able to debate and listen to what's going on in other parts of the county and wider afield, and we've also got our own Health and Wellbeing Board that's meeting tomorrow, where we have opportunities to have presentations and open floor as to what issues are on the horizon that need to be addressed and how we can collaborate and work in partnership to overcome those challenges.
Lovely. Thank you. I've got Peter next, please.
Thank you, Chairman, and thank you for an impressive overview of this project. You heard the word phenomenal mentioned, and it is phenomenal when you look at the amount of outside bodies you're actually working with to support us and our residents. Yana, for instance, how many people know about that agricultural service of Yana for mental health with farm workers under pressure all the time now? And I'm pleased with that because I had to refer a farmer and an employee only a few months ago, before Christmas. He had issues, and the whole system works. As you said, you've heard the word evolve as well. I've seen it evolve over the years to meet the needs of our residents. In particular, I can speak of the cup of tea programme, which I recognise there was that gap, and it was just taken on by the YAB and 100% supported by Breckland, and without Breckland support possibly that wouldn't have got to the stage it has now. And I can tell you that the numbers actually are now more than 90 families helped through that programme. It's just, like I said, I'll repeat that word, phenomenal. And I just need to ask the question, Chairman, why are we here? We've had an overview of the system, it works, it's evolving every year, meeting all the needs, and I can't say any more really, but just thanks to the officers for the phenomenal work they are doing.
Thank you, Peter. I've got Sam next, please.
Thanks, Terry. As a parent that's lost a child to suicide, I believe the work we're doing within our communities is amazing. When I lost my son, there was nothing like this readily available, but not only easily available, well advertised and free. The 90 families we've supported through our mental health scheme means there are potentially 90 families in our district that may not have to live the experience my family have lived and still do 10 years later. I'm curious to know how many of us have attended any of these courses that we offer through our mental health support to understand from the inside the work that is happening through this programme. And I'd also like to finish with, after the awful floods Outborough has suffered recently, I'm curious to know how many of us have been out with our community enablers and seen firsthand their dedication and compassion they show our residents. Because I hope I can speak for all Attleborough ward members and say we have been amazed by their work and the support that they give. Cheers.
Lovely. Thank you, and thank you for sharing that, Sam. On the specific point about the training, I think I'm correct in assuming that all councillors are equally able to attend the mental health training. I've certainly attended one in the past. Are there any sort of scheduled in the future specifically that members can? I think it's a good opportunity to promote the opportunity if there is.
I can provide you with a full list.
I think that'd be really useful, because I think Sam's point is perfectly valid, that we as councillors increasingly find mental health related casework, and the training is actually really useful for us.
I have attended some.
It's very good. Steve?
Yeah, just to build on that, Chairman, is that when we started, we're referring to our Mindful Towns programme, and that was because as a council and working with partnership, we understood the need to have people who are confident and competent to have a conversation about mental health at the local level. So we started with mental health first aid training, but like with many things in this programme, we learned as we went along, and we built that network of 300 trained mental health champions across this district. And we've now go beyond mental health first aid training. We now work with a hospice to give bereavement training as well as child bereavement training. We also deliver youth mental health training. So as with the other things, we start something off as a district council in an innovative way. We learn as we go along, and then we develop it for the benefit of our residents.
Lovely, thank you. I believe there's a child bereavement training Monday this week, which I know several councillors attended, so very good. Robert, next, please.
Thank you, Chairman. Your introduction said this is about getting it right and ensuring outcomes. Sort of two-part question. In terms of ensuring outcomes, is this part of the quarterly performance reports? Are outcomes from this programme regularly reported to that team? And secondly, in terms of outcomes from the previous programme, I noticed that the interventions on social isolation were roughly £10,000 per person. Was that a Breckland spend or a partner spend? Thank you.
Thank you, Robert. Who wants to take that one?
Do you want me to just? Yeah. Okay. So in terms of the KPIs, we collect all the data as a team in order that we can manage those contracts effectively. And they aren't, as far as I'm best aware, Josh, they don't go forwards to the performance report, but they are managed by the team. That's the role of the team, is to look at delivery and the impact that those services are having. And of course, we do come to scrutiny as well to enable members to have a look in more detail about what those services are delivering. In terms of social isolation and loneliness, I think we have to look at, sorry, was the question around the cost per intervention? Well, I mean, those figures are what they are, but actually when you look at the impact of social isolation and loneliness in terms of on the individual, but then on the wider system, the costs are a lot greater than our investment. For instance, through that scheme, we have seen, as I've said, reductions in some of the knock-on effects of people being socially isolated and loneliness. So that programme was independently evaluated by the University of Arts London and Dementia Research Centre, and they saw that 87% of the participants reported attending the sessions which we were commissioning through Creative Arts East. Their mental health and wellbeing showed a 30% decrease in anxiety, as just one of the indicators. That has an impact on the wider system. It's less GP visits, it's less crisis level appointments, and it's less people presenting to us in need.
Thank you. Just on your point, Robert, about KPIs, it occurs to me that our next meeting, actually, we've got Alison coming to talk about the performance report and the KPIs generally. I think that would be a really good opportunity to have a conversation about what measures within the Inspiring Communities programme we might want to add to that report. I mean, there was a couple of things in the presentation that were certainly new to me today. The figure of, I think it was £900,000 of additional income. You know, that is that's measurable, and that's money that's coming into the district to support residents. So we might want to have a think about amending the performance report to track some of that when we review that next month. Alison, thought you might.
Yeah. Quite happy. But one thing I will say is that quite a lot of this stuff is not measurable, and this is the challenge.
Yes, absolutely.
And it's because of the softness, the results of the impact on people. You cannot measure it. Suicide. How can you measure how many people are suicide? You can't go for a target. We're going to stop 5 people from committing suicide. Oh, we didn't meet that target this time. It just wouldn't work. So all I'm saying, yes, happy, as long as the measures are measurable, and the team is happy that the measures are measurable. The other thing I'd like to say is that I would suggest 6 monthly or something, because you've got to see the difference from where we are now to where we're going to be or what we're measuring, rather than monthly reports or something that wouldn't really give the true picture of what we're doing, what the team are doing. So quite happy to take that on board, and I'll discuss with Councillor Ashby the proposals, and we'll come to some agreement, won't we?
Yeah.
Thank you.
No, that's fine. I would hope everything on our performance report is measurable. So with that health warning, I agree. I've got Linda, please.
Thank you, Chairman. I just want to back up what some of my colleagues have said. Back in the day when I was the portfolio holder for communities, and then Alison took over and now Tristan, back in that day, it was a nice thing to do. It was even called Fluffy, a service. And it happened, and Steve and the team and I have worked together for many years. I used to head up with the Older People's Forum, etc., etc. So what I want to emphasise is how far this has come since those days. And if I use the Older People's Forum as an example, so it was set up, and this is a national and a county-wide body, but our purpose was always to come to an end because someone else was picking up the pieces. And that's exactly what we did. We ran for a few years. We highlighted through the team the work about loneliness, isolation, housing for older people, anything at all to do with older people. Even if we were called the Grey Brigade, it still worked. To the point when, because Breckland was at the right point, we could hand that into the team. And I'm so delighted that things like the Silver Social, etc., are now carrying on in a different format because the world has changed. You know, we've got through the pandemic, and I know how much work that team did during the pandemic. Some members were given a list of vulnerable people, not where they lived, but somewhere else to be anonymous, to ring during the pandemic. I still ring my little group in Swaffham, and we just have a little chat. It's almost just a friendly thing now. But it's the importance of this golden thread running through that from very small beginnings has come this. We should be very proud of it. We're on the right trajectory, and I absolutely fully support the work. Thank you, Chairman.
Lovely. Thank you, Linda. That's useful context. Gordon, please.
Thank you, Chairman, and thank you for having me, as I'm not a member of this committee. I have, of course, been following this over the several years. I didn't realise it all started in 2018, but I suppose I could have looked back that far. I have been following this, but I have come to realise in the last few weeks, as we've been talking about it one way and another in Council, how little really I know about the actual programme. And I have suggested to Sarah a little bit earlier that I'd quite like to find out a bit more, and I can do that outside of this meeting. But I do just want to ask the committee, the team in this about loneliness, and especially about loneliness in rural areas. People who live in rural areas sometimes don't have a neighbour, maybe for several hundred yards or even a mile or more. And they can be very lonely and isolated, especially if it's a person living alone. And they may not be people who would come to the obvious contact points that you have listed. And all of them are very important, and I support all of what you're doing in that. I had a friend who died quite recently who was a merchant banker, and sometimes I would talk about these issues with him because he also, on the quiet, used to be very helpful with homeless in his area, and he would feed them and serve them and go on. And he always said to me, yes, he said, but you must also remember the up and outs as well as the down and outs. And that was a very real thing. And I mean, that may not be a very PC thing to say these days, but that was what he always would put to me when I was talking about these issues. I would like to think that you could devise a way of reaching these rural, lonely, and indeed in some of the other things as well. The rural poor are important, and I think we're starting to reach out to them. I think the rural lonely are something that we are probably still missing. And I come across rural lonely in my work as a district councillor, and I don't know what the answer is, but I'm sure you can think of something. Thank you.
Thank you. It's a good challenge, Gordon. Steve.
Brilliant. You make a very real and valid point. It's one of the biggest challenges that we have. 500 square miles is the area of our district. 50%-ish of people living in towns, 50%-ish of people living around those towns. And the truth is, this is a challenge not just for loneliness, but across a whole load of things. And we have to recognise that we can't do everything. We can't do everything, and we won't reach everyone. But what we can do is to put things in place that give the people who are lonely and isolated the best chance to engage. So Breckland Arts for Health, it was mentioned up there as being the Silver Social. That's evolved now to become Breckland Arts for Health. Why has that happened? Because we started funding it, we kept it going, it became established, and then we reduced and withdrew our funding because Creative Arts East, the arts charity, are able to draw in external funding to keep that going. That's delivered in some of our villages as well. That's not just purely in towns, that's across villages. And it's free to attend, and they advertise it. But I think as well, when Josh mentioned... Sorry, I've forgotten how I was going to end that then. I was in mid-flow. When Josh mentioned earlier about our welfare support, and one of the biggest issues that our welfare support officers are dealing with is social isolation and loneliness. One of the biggest referral reasons to our social prescribers from GPs is social isolation and loneliness. So they are residents who are routinely going to have visits with the GP surgery, but actually probably just to have a chat with somebody. That's not the best way for the system to deal with that. So our social prescribers receive that referral. And this is where we need to look at inspiring communities as a system-wide approach, because the role of the community enablers is to work with community groups to help communities to help set up local level groups, coffee mornings, etc., to give the social prescribers a place that we can point lonely people to. So that's how we view inspiring communities, and hopefully that tube map illustrates the complexity of the system, but hopefully we've helped to explain how we're playing a role within that system.
Thank you. Tristan, do you want to come in on that? You can get that one to work.
Thank you, Chair. It was just to add that attending some of the meetings that I have over the last 10 months, the value of sharing information, sharing data. It's not just about loneliness, but various partners are looking at ways of sharing data with other partners while not falling foul of GDPR. So there's some innovative work that's being undertaken to ensure that more and more and more people are being identified within the system.
Lovely. Thank you. I've got some members who want to come back with a second point, but before I do that, is there anyone who hasn't spoken who would like to contribute, please? William.
Yeah, I think I was leader when I think it was Steve, James and Rob first proposed this concept, and I was probably the person, Rob may have been, well, Rob didn't say it, Linda said it, around the fluffy. And I would just, I don't want to defend the fluffy, but I will just say many years ago I did a thing called Should We, Could We? And it was really to make the council a place where we really focused in on reducing the cost of our overheads, of our services, of anything we were doing that was kind of the day-to-day noise of the council, stuff we have to do, to actually allow us to do things like this. And I know when Steve and Rob put the project together, the concept, you know, dare I say we kept politicians out of it, because I still think as best we can we should keep the politics and the politicians away from this concept. I think it's an exemplar thing. I think what they've done by merging and managing with all the various partners across the county really is both fascinating to watch. I was slightly disappointed you called it in, I have to say, Terry, because I think of all the things we could call in, this isn't the one. If you'd said let's put it to council so that we could kind of widen the vision for this, I would totally support that. I think everybody should hear the presentation, and I know when you did it to Cabinet there was a very small audience there, and to be fair it's just the same audience here. So I don't, you know, I feel we're slightly wasting dare I say, the officer's time, but at the same time, thank you very much for coming along to do this today. But it is an exemplar scheme. You've done some fascinating and fantastic work across our communities. And I guess I also want to thank Sam and my Cabinet colleagues for being so robust in setting their budgets. You know, as Terry tweeted straight away after Council and again this morning about the budget, it is challenging. But the Conservative team here have done an excellent job of making sure the Council is efficient, effective, but still managing to focus another £1.12 million towards this project for the next couple of years. And I don't think there are any other districts across the country that are able to focus and deliver the sort of projects that we're able to deliver by running the council so efficiently and actually focusing on the things that are really important to social conservatives, to helping those people that generally have fallen off and are struggling, to making sure that the projects we're doing, as Steve said, we can't deliver to everybody. We recognise there are things we can't do, and I'm sure we'd love to do more and more. But we're all working in this sort of complex agenda of reducing budgets and indeed expanding demand. So that's always going to be a challenge. But I wanted to thank the team, really. I think you do an excellent job. I think some of the partnerships you've set up and delivered are exemplar and actually should be recognised wherever they can be presented.
Thank you. I note your disappointment, William, but I was equally disappointed that it didn't automatically come to scrutiny before it went to Cabinet. I was disappointed there was a need to call it in, frankly. The Commission is here to scrutinise policy. This is a big policy, it's an important policy, and it should be debated at scrutiny. That's my view. And that's why I felt it was important to call it in, because we've debated all sorts of policies and procedures over the last few months. This is fundamental to the work of the Council. It should be discussed at scrutiny.
And it was last September before it came to Cabinet. So, I mean, I agree. I love your grandstanding on this, but it was at scrutiny. It's coming back to scrutiny. It's on our forward plan. It was on our forward plan last year. So we have debated it. We supported it last time, and I'm pretty sure everyone here agrees that it's an excellent. I don't think there's anyone in the room that feels the need to grill these people on things that they're not doing well. And as yet, I haven't heard you put a single thing forward that you want them to either do better or indeed stop to refocus the money. So I'd rather they were spending their time helping the vulnerable now than talking to us.
Thank you for your contribution. I've got a couple of points which might answer your queries there. The first point was around co-design and co-production, because I was really pleased to see that in the report. And it's absolutely crucial for programmes of this nature to have an element of co-design and co-production. It's quite clear that partners are involved in that co-design. I just wondered if you could outline for me, probably Tristan, it's appropriate for you as the Cabinet member, how members of this council have been involved in co-design, but also service users. How have they shaped the programme that we're looking at here?
Yeah, I think we've become better in recent months with regards to demonstrating what the programme has been doing and welcome the input that anybody, particularly councillors, can provide to that, and very similar to the response to Councillor Clark on that. In terms of the users, I think the officers, and you've seen all the officers that are involved in this throughout the programme, are listening to the users all the time. And that is fed back to the team to ensure that, as I said again earlier, we are a learning council, we are a listening council. So can we do it more? I'm sure we can. But are we doing it? 100% we are.
Okay, good. Pleased to hear that. Second point is around what's missing. If I look at the list of programmes and think about my own ward and my own community, one of the really big challenges that we've got, particularly with vulnerable people, is around drugs and county lines. There's a really big cohort of very vulnerable people in Thetford getting involved in county lines, and this impacts their life for a long period. Is there anything in the programme moving forward that seeks to address substance misuse, county lines and sort of criminality? That's an area that I'd like to see more focus on, but it may be in there, but I've not seen it.
Working with the police is they're one of our main partners. We've been working closely with the police for many years. We have an operational partnership team where local police officers come together with our antisocial behaviour officers to understand at a local level some of those issues that are happening. We've started to explore some opportunities around contextual safeguarding. Are the places that young people go to that put them at particular risk for antisocial behaviour? I think, speaking of examples in Thetford about how we've made changes in terms of contextual safeguarding, was around just simple things like the opening up of Button Island to make that visible and brighter, to stop young people congregating and then being an access point for those who want to encourage them into county lines. There are other things which we are doing with the police. Some things are yet to come online. It's a bit too early to mention them yet. But I think just in general, the work on a day-to-day basis that we are doing is helping to tackle county lines, to avoid county lines and promote it with children. One of the things we're looking to do is to take devise, not ourselves, but work with a provider to devise a county lines workshop type performance that could perhaps go into schools, for example. So it's things that we're trying to develop in partnership to get to educate children around it.
That's really encouraging. I'll be really pleased to see that feature more prominently, because I think, certainly talking to other members, it's not just Thetford, but I certainly see it and feel it in Thetford. The last point I want to make, because I'm conscious of time, and there's a couple of people who want to speak still. Very pleased to see in the presentation conversation about housing and communities working closer together. That's an obvious. Last month we heard from the lady from ARP. Nearly always when I have a surgery or I'm encountered with people that have debt issues or are struggling financially and have food-related issues, included in the pack of paper they bring me is a demand from ARP and sometimes a court summons. Are you aiming to work in phase 2 closer with ARP and address that issue of the one aspect of the council is actually causing quite a lot of mental health problems, chasing people for debt, and on the other hand we're trying to support people? Huge opportunities for synergy there. Is that going to be taken forward with phase 2?
Thank you, Chairman. I think yes. What we're looking at is we are trying as best as we can to view the whole system, to find out all the different things that are going on in people's lives, and when they touch our system at one point, are we able to use that as a flag that there's a problem somewhere else? It is absolutely. We've started conversations with ARP. We've had some meetings with them about what type of data they're collecting, which may be a useful flag for the communities team, for the housing team, to be able to support them. Residents don't particularly care how we structure ourselves, they just want help. And I think as well as that, Chairman, is the investment by the council in £88,000 for the debt advisors is hopefully picking some of that stuff up. It's not just debt advice, it's income maximisation to help make sure if people need to be on council tax reduction discount that they're aware of it and they're getting it. So it is absolutely something that we want to do moving forwards.
Thank you. Josh, did you want to add to that? I was sort of indicating, or Steve covered it?
Yes, just quickly. So as Steve quite rightly alluded to, we're already having conversations with ARP about how we can work closer together. But one of the points that I'd like to just raise is the fact that what we've suggested is utilising our collaboration meeting better between ARP to ensure that we are kind of providing that cohesive approach to supporting residents. So whilst we are having that conversation with ARP, it's ensuring that not only ARP but the wider system are aware of the pressures which some vulnerable residents are under. So we're utilising what we've already got in place and so strongly in place with our partners to hopefully provide a better and a more holistic service to our residents.
Thank you. Certainly my feedback from as a ward member and on the ground supporting people is there's a bit of a disconnect between ARP and the communities team, and whatever we can do to bring that together. So I'm very pleased that you're aware of that. So moving on, I've got Sarah, Jacob, Harry and Gordon wanting to contribute before we finish, and Claire. Is there anyone else that wants to say anything before we come to a close? Nope. Moving on to Sarah then, please.
Thanks, Chair. Not going to lie, a bit disappointed that what I thought was a procedural point about not being able to read a table was taken both as my contribution and not actually acted upon. I haven't received it. So please could someone literally just screenshot it quickly and pop it in a Teams chat or something so I can see it? That would be fab, thank you. So notwithstanding that point, so if I can just take a look and reserve the right to just quickly ask my question if that supports it, that would be fab. So I'll just rattle through these. Obviously, I am alive to the fact that this is an ongoing programme. It has been discussed in various fora, but obviously I'm a relatively new councillor and I haven't been in those meetings. So I do have a few observations / questions. So in the budget setting full council, there was a lot of reliance on the flexibility within this programme. When I look at the table in 1.5, the funding is rightly and out of necessity, it seems very allocated, which is appropriate. You know, you want that kind of longevity. So could someone just walk me through where the flexibility is within that breakdown of costs and that funding that was relied upon within the budget? Then the at 5.2, there's a discussion around external funding that's been that we secured going forward to deliver additional services, which I'm taking, but please correct me if I'm wrong, to be supplementary to the 1.2 million. It'd be interesting to know also what funding has been secured within the programme to date, just within the recent past, just to bring that to life for me, please. And then what funding sources are anticipated for 24-25, because as you all know, we all get sight of kind of funding pots that are coming online. So that'd be very helpful. And then my last question is at 1.4.2, there's a discussion around the £5,000 match funding grants, which I definitely welcome. I welcome a lot of this, but I would love to see us doing more. And I think there are definitely routes to achieving more. So given the reliance on the third sector to address the shortfall in social service provision, children's services, social care, all of those, which we're all alive to, please could someone just walk me through how, if and how, any option testing has been done around both making grants available that are not match funded. And the reason why I ask that specifically is because I'm taking as read community-led, in inverted commas, to mean largely third sector approaches. There has to be a vehicle to do that, and a lot of the vehicles that we rely on in Breckland are very small. But also, sort of conversely, has there been any option testing or discussion around a provision of larger rounds of funding? And that in particular really interests me. I was listening to the leader of Berkshire Council yesterday talking about the fact that councils, and by extension a lot of our community organisations, and I chair one of them, spend an enormous amount of time and resource on bidding for competitive funding to then fail at them because it's a small pot of funds. And given the reliance on, as I say, on those third sector organisations, I'd be really keen to see if there are any opportunities to actually enable those third sector organisations to do more. Because ultimately, the shortfall that they're responding to is profound, and there's only so much they can do with £5,000. So from my point of view, 1.4.2 is very limited, and I understand why, because you want to touch as many parts of the community as possible. I completely understand that. But I would be very interested to know that. Thank you.
Thank you, Sarah.
Yeah, so in terms of the budget, I think it's right and proper that officers bring forwards a costed plan to members for decisions. But what we've seen, and certainly, hopefully, the presentation showed how a programme can flex and change over time. It started off very focused on 4 priorities, but then over time, as happens with longer term programmes, it's able to shift and move. And the money is allocated to roles within that budget, but again, we've shown how roles can change and evolve, and people can adapt and do different things. The money for the grant funding, for example, is something that's set aside, but that's spent on an annual basis and provides us an opportunity on an annual basis, therefore, to divert that funding somewhere else if we feel it's more appropriate. In terms of funding for the third sector, historically, we've believed that our match funding is best placed in the hands of our local community and our residents, and that actually some of those hyper-local initiatives actually in themselves divert demand away from the third sector and certainly divert demand away from frontline services. So that's why we have continued our approach for match funding in terms of making it available to our community groups. Third sector is absolutely under pressure, and that's why we work closely with them. We work closely with charities, with community groups, and we're funding citizens' advice, of course. And then, yeah, and then Josh will answer the last one.
There we go. That's better. Yeah. So thank you for your questions. So the match funding specifically. There are other organisations who will be able to apply for the match funding. So you touched upon the voluntary and community organisation first and foremost, but we are looking to open it up to parish and town councils as well within the Breckland area, schools from the Breckland area as well, not-for-profit social enterprises or community interest companies, and also alongside church groups for secular projects as well. So it's hopefully, well, it's going to be wider than just that focus and putting the undue strain upon the voluntary sector. It's looking at wider how we can really make an impact, and there's ultimately real opportunities. And just want to allude to Councillor the point raised around county lines. There's a real opportunity potentially for organisations to come forward and provide some insight or projects which contribute and tackle county lines, for instance, or other antisocial behaviour issues, health inequalities in general, in schools alongside that. So there's multiple avenues which can be explored, and we are currently in the process of working through the whole list of requirements which can be provided within a match funding scheme for the next 3 years.
Okay, thank you very much. I've got Jacob. Did you still have a point you want to make?
Yeah, I just wanted to echo Sam's point about services that this is going to provide that simply weren't there before. It's not a statutory service, and I just think we should be really proud that we're using our position and our resources to really go above and beyond for our residents. I'm particularly pleased to see about the Early Help Hub in Dereham. I think it's a great idea to bring everything under one roof. It'd be great if we can make sure that's accessible as possible for other parts of the district. Just working in the vaccination programme, I'm aware that the ICS ran a scheme to help people with transport to and from appointments to increase vaccine uptake. Just wonder whether that's something that could be considered as part of that planning.
Brilliant, thank you. Thanks for the endorsement of the work around the Help Hub in Dereham. It isn't. It's geographically based in Dereham, but isn't. You don't have to be from a Dereham postcode to access it. And of course, what we are also looking into is, of course, this council funds quite a considerable amount of money for community car schemes, and they are across our districts and locally led. And we have enable people to access GP surgeries, etc., because of the funding into this. So it's something that behind the scenes, not showcased as part of this, but is continuing as part of our investment as well.
Thank you. Harry, please.
Thank you, Chairman. Just picking up just some of the remarks of Councillor Bambridge and also Councillor Ashby, Tristan. I just think when the slides go out to members, I think it probably would be helpful if you if we have a link in there. Some of it's, I think, on the County Council website to the Wellbeing Board Integrated Care Partnership. If people want to go in there and subscribe to the agendas, and obviously there is an opportunity, at least in one of those meetings, for example, 6th of March, for the public to submit questions, but also to follow what's going on. And obviously we'll be supportive of Tristan as our representative on 6th of March, which is a 3-hour agenda followed by a second agenda. And the first part of the agenda I've noted is a mere 314 pages. But if you look through the breadth, particularly of the partnership board, if you look at things like Police and Crime Commissioner, Children's Services, etc., and then you delve into the care partnership and you look at things like cancer, a whole range of different specialities and things which cut across the whole of the district, some which may be relevant to us or not, but I think it'd be helpful for people to have that link and they can either subscribe to those agendas, but as we've also got our health and wellbeing strategy, or the current one, on the website, if there's a link in there, then people can delve into that to follow things in a little bit more detail. That would be helpful. Thank you. Thank you, Chairman.
Noted. Thank you. Gordon?
Well, I was just going to say, Chairman, when you spoke about county lines and then one or two others have since. I mean, county lines, of course, started, I believe, in Norfolk, must be, 10, 12 years ago now, whenever, I can't remember. But this council, individual councillors can, and any councillor can get involved with the Safer Neighbourhood meetings, which are held in our 5 market towns, and they regularly deal with county lines issues for those towns. So we are and can be involved in that way, and councillors can contribute.
Thank you. Yeah, that's a very valid point. Claire, last speaker.
Thank you, Chairman. Well, I'm fully supportive of all the admirable work and the valuable work done undertaken by the Inspiring Communities team. But I just wanted to take the opportunity to commend, and I hope the Chairman will join me, the award-winning Community Health Worker Scheme, piloted in my ward in Watton in collaboration with Watton Medical Practice. And as we've heard, the health workers have been able to reach out very effectively to help vulnerable people in the area and those who may not previously have accessed the help they need until reaching crisis point. As we've heard, this has meant the difference between life and death. Thank you.
Absolutely. Thank you for raising that. I found out some more information about that recently, and it's certainly an exemplar, so, really encouraging. I'm going to bring us back to the agenda, folks, because we've got a decision to be made. I just wanted to recap on the sort of outcomes of the discussion. I think we've got Robert's point around the KPIs and the performance report, which we'll try and pick up at the next meeting. If there are suggestions around things that members feel would be particularly useful to measure, taking on board absolutely Alison's point about, dare I use the word smart, when it comes to KPIs, but I think that's very valid. So I think if we can include that next month, that would be useful. And I think it was David and Gordon that made the point about greater information being made available to members so that we can share that with particularly parish and town councils or any groups. I think probably every councillor in this room is a member of a voluntary and community group, and we want to use those networks as well. So hopefully one of the takeaways can be around information sharing for members and involvement, which I think is really useful. So the options before us is either to recommend a decision is reconsidered by those who made it, in this case Cabinet, to review or refer the functional reviewed aspect to decision to full council, or 3, to take no further action. Could I ask for a proposal, please, for one of those 3 options? William.
I propose that no further action is taken.
Thank you very much. Is there a seconder, please? Jacob, all those in favour? Thank you very much. Noted. Thank you ever so much, team, for coming along. Hopefully you found that useful and constructive. And this is an ongoing journey, and I'm sure there'll be conversations to be had at a later date. But I'm sure the Commission wishes you all the success in the work that you do, and look forward to working alongside you. With no further business, just to note the date of the next meeting is the 14th of March. We do have Citizens Advice Bureau here, who were mentioned in the report, so that will be a good follow-up from today's discussion, and we'll be talking about performance generally with Alison. But thank you all very much for your time today.